And this event is being recorded for those of you who are not joining us live, and for those of you who opt to use it to rally your advocates to the cause that brings us here today. We certainly hope that you will use this event as a resource in your own efforts. And by the way, for the record, we at Hazel and Betty Ford apologize for the technical snafu that derailed our initial effort 2 weeks ago. As many of us know, it is all about progress, not perfection, but nevertheless, we know it was a great inconvenience to many of you who had logged in, including our panelists today. And again, we're sorry that that happened, but here we are. And in that spirit of getting together, you know, in the old days, way back in 2019, before COVID, well, in those times when there was a policy issue that demanded our attention and our action, Hazel and Betty Ford was always quick and willing to call together, usually at one of our facilities, a group of grassroots advocates and local organizations, and we'd headline the gathering with members of Congress or state legislators who were the champions for the issue or the legislation that we supported and wanted to turn into sound public policy. Yes, indeed, those were the good old days of advocacy, as there's nothing quite like a room crowded with fired up advocates and policy mavens and makers and coming together to discuss and promote legislation that matters in the field of addiction, from prevention and research to treatment or recovery support. But in these times, the threat of COVID, as we all know, is still with us. And so we can't be together today, at least not in the same room, but we are together virtually. More than 160 people have registered for this event, a roundtable conversation for the next hour about proposed federal funding with direct implications for millions of women and men and families who know firsthand the power of addiction, the promise and possibility of recovery, and the importance of finding support close to home in their communities, big cities, rural towns, bucolic suburbs, all across the red states and the blue states that make up the United States. Indeed, for many of us, me included, treatment for addiction is only the beginning. Recovery is the rest of the journey, a journey that requires support from peers and professionals, and bolstered in many places by an RCO, a Recovery Community Organization. We have a panel of leaders from some of these RCOs from around the country, and we'll hear from them in just a few moments, as well as other experts who are joining us today. But first, let's dive into the details of what's at stake with Congressman Dean Phillips, a Democrat from Minnesota's 3rd District, a district that includes Hazel and Betty Ford's treatment facility for adolescents and young adults in suburban Minneapolis. We are honored that Congressman Phillips is going to join us today with his insights into the issue on the table at the moment, President Biden's budget, specifically a major increase in the substance use prevention and treatment block grants to states, and his proposal to include something that we haven't seen before at the federal level, a requirement that 10% of the increase funding be devoted solely to recovery support organizations. Congressman Phillips had hoped to join us today live, but for the moment at least, he's presenting us with a video that will stand in for him until perhaps he can join us towards the end of the hour. So let's roll the video.
Hey everybody, it's Congressman Dean Phillips, and I'm so sorry I can't be with you today, but grateful to you, William, for the introduction to Hazelton Betty Ford, the Minnesota Recovery Connection, and all the other organizations and advocates who are coming together to raise attention about the need for recovery services funding. I want to thank all of you attendees as well for taking the time to learn more and making your support known throughout our country. I understand and recognize the need for recovery services funding. Let me assure you of that. I spent time with countless constituents in Minnesota and around the country. Colleen Ronnie, who lost her son Luke to an opioid overdose in 2016, is a wonderful example of someone who's making an amazing difference in Minnesota and beyond. After Luke's death, she started an organization called Change the Outcome. I'm grateful to you, Colleen, and to all of you who are prioritizing such an important need. Minnesota has long been known as the recovery capital of the world. Many of you know that, in part because of the thousands of people living in recovery who've dedicated themselves to building a community that supports and grows healthier futures for the people that live here. You all know that 70% of addiction and substance use disorder, SUD, treatment services are publicly funded. We need to dedicate more. Recovery support services will receive less than 1% of Minnesota's overall state and federal spending on SUD. We've got to fix that. And that's led to our current situation. Minnesota now has over 400 licensed treatment providers, but only 14 recovery community organizations, RCOs, most of which are very small and have limited abilities to provide services to support the people who are immediately pre and post treatment. These are issues that we must address, and that's why I'm grateful you're convening today. Now, let me talk a little about the status of recovery services funding in the 117th Congress. Fortunately, members of Congress on both sides of the aisle are recognizing and in agreement that we must provide more funding for those who struggle with dependence on substances in our communities, and an awareness that supporting recovery services is actually supporting prevention. The opioid epidemic, systemic racial and economic inequities, and the unfolding long-term impact of the COVID-19 pandemic continue to expose alarming gaps in our continuum of care for people affected by substance use disorders, and also make it clear that these are problems that touch nearly every single American family, every single one. As the vice chair of the Problem Solvers Caucus, the bipartisan group of 29 Democrats and 29 Republicans looking for solutions, I believe one of the most important roles is to bring Republicans and Democrats together on areas like this one, where we can find common ground, meaningful consensus, and improve the lives of millions of Americans. Be a beacon around the entire world, in fact. I'm proud to support President Biden's proposed budget increase of the federal substance abuse prevention and treatment block grant by $1.7 billion, with a 10% set aside for recovery services. It's the first time that recovery support would receive specifically allocated funding, a big achievement. I'm also co-sponsor of a bill that was introduced by my friend and colleague, Representative Abigail Spanberger, called the Support Recovery from Addiction Act, which takes that one step further and makes the 10% recovery set aside in federal block grants permanent. Another big step in the right direction. Now, we've got a lot of work to do in the future. This is just a beginning, as all of you know. So thank you so much for inviting me today. I'm sorry I can't be with you in person, but I'm looking forward to hearing from our expert panelists sometime after my day today. I will take everything I hear back to Congress with me as I continue to fight for funding and policies to provide relief to those in our communities who are battling addiction and substance use disorders. Rest assured, I've got your backs. Keep the faith, keep in touch, and look forward to seeing you all very soon. Bye-bye.
Well, that worked out pretty well, considering it was somewhat last minute, or Congressman Phillips was called away. That was a good video, and I think it sort of summarized where we stand, what the issue is, and what we need to do to push this forward. So at this time, I'd like to go ahead and introduce our panelists. I'm going to ask each of them just to say hello so they can show up on the screen. We want to dive deeper into the dynamics of recovery community organizations with a panel whose expertise and whose lived experiences are the heart and soul and the fiber of these organizations across the country. Because as we just heard, the dollars in President Biden's budget would flow directly to organizations that are represented here today. So let's meet the team, starting with Wendy Jones, the Executive Director of Minnesota Recovery Connection, the largest RCO in the state. Wendy, could you take yourself off of mic or mute and say hello?
Greetings, everyone.
Thanks for being here with us, Wendy. And we have from the other coast, Lauren Davis, who not only is the founding director of the Washington Recovery Alliance in Seattle, but Lauren is also an elected member of the Washington State Legislature. Lauren, please say hello.
Hi, good morning from Seattle and good afternoon to the rest of the country.
Also with us today is Tori Utley, the co-founder, along with her dad, of Doc's Recovery House in Rochester, Minnesota. Tori is also a colleague of ours at Hazel and Betty Ford. Tori, please say hello.
Hello, everyone. Happy to be here.
We've also got Greg Williams, a renowned national recovery advocate and filmmaker whose unprecedented documentary, the anonymous people, galvanized our field of recovery advocates almost a decade ago. Greg is the managing director of Third Horizon Strategies and authored a critical document on RCOs that he will share with us in just a couple of minutes. Greg, can you say hello?
Thanks, William. It's great to be here. Thanks for having me.
Thanks. And finally, I hope he's come back on. I know we had a little technical issue. Mark Jonigan, my friend and fellow traveler, who is also the founder and CEO of Twin Cities Recovery Project. Mark's an advocate, as I said, and I'm also proud to call him my friend. Mark, are you on? If you're back on, say hello. Not yet. So we'll come back to Mark in a couple of minutes. Let's start with you, Wendy. I know that you and your board chair, Jeremy Drucker, have been working with my colleagues at Hazel and Betty Ford, Emily Piper and Jeremiah Gardner, to do a lot of advocacy around this issue. Can you share that with us and how others close to home and across the country can get involved in this important legislation, Wendy?
Absolutely. Thanks so much for having me today. And I just want to say first off that I am a person in long-term recovery from substance use disorder, and that is very important to the work of recovery community organizations, that we are grassroots, community-led nonprofits. We exist for the sole purpose of increasing the quality and the quantity of recovery in our communities. And so we're governed and led by members of the recovery community and offer free, no barrier peer recovery support services. And so our advocacy around this issue of increasing support for recovery community organizations stems actually in response to some of the things that Representative Phillips touched on. I want to point out that he did mention that Minnesota has long been known as the recovery capital of the world, and we're proud of that. But I would add that it's recovery for some people, not everyone. And that's at the heart of why we need sustainable recovery community organizations. There's only 1 out of 10 individuals in Minnesota and across the country that actually accesses treatment. And Minnesota actually has one of the lower rates of treatment completion in this state. And for most people around the country, those who complete a course of treatment, about 65% will return to use within the next year. And then you compound that with racial disparities, which is a significant issue in Minnesota especially. And so recovery community organizations are needed to address these gaps in this system, to acknowledge that there's a lack of recovery capital for a lot of us, that those resources sort of in the metaphorical bank that enable us to get into treatment or to initiate recovery, or when we get out of a program, to have the resources to sustain that life in recovery. And that often looks like getting a job, finding a place to live, finding a supportive community, and finding something that works for me. So recovery community organizations are sort of like these department stores for recovery that honor all pathways. No matter what path someone is on that works for them, we're here to support that and to help remove those barriers and to help people work with, like, what's next in my recovery that I need for that. So it's critical that we encourage a dedicated source of sustainable funding for these community-based resources, which I'll hear about more when my colleagues speak. And so the advocacy around this has included a support letter with over 40 organizations that have signed on to it that was sent to the Minnesota congressional delegation. And what's really important about this letter is that it's a cross-section of organizations, from Allina Health and Mayo Clinic, our colleagues at Hazelden and other treatment providers, the Minnesota Hospital Association, Minnesota Medical Association, NAMI Minnesota, and our recovery community organizations in Minnesota. And this cross-section is crucial because it really represents a recognition that we have to look at recovery from a holistic perspective. We can't just have these emergency rooms for recovery and not think about what happens when someone goes back into the community and the lifetime of that individual. So having a cross-section of organizations supporting this initiative is a huge milestone for us in this effort. And we're all interconnected in this goal to collaboratively improve lives, but save lives. And so we've also had a digital call to action, which I think Jeremiah is going to put in the chat later on. It's really important that individuals speak up about this with their elected representatives. No matter what stage the legislation is in, our representatives need to hear from us that this is an issue that affects everyone. There's hardly, I don't think there is an individual in the country that isn't in some way affected by substance use disorder. And when we talk about it, when we decrease the stigma, remove the shame around talking about it and think of it as a health condition, that normalizes recovery. And so just to kind of wrap up on some of these advocacy issues that we've been working with Hazelton, Betty Ford, and others on, it is critical that this legislation moves forward because recovery supports have been grossly underfunded, yet they're desperately needed. We wouldn't think of only funding emergency rooms in this country, yet in many ways, as Representative Phillips pointed out, with the lack of recovery support services, that's kind of what we've been doing. And so we can't make any progress in addressing the addiction epidemic in this country until we think about it holistically. We start with the individual, no matter where they are on that pathway to finding a better life, and we put that support in place. And that's what recovery community organizations do.
Thanks a lot, Wendy. I see in the chat that Jeremiah has in fact posted the link. It says advocate for recovery funding through our advocacy for recovery funding through our digital call to action. He says it takes just about a minute. There's the link. So please cut and paste and get into action. I'm glad to see that our colleague Mark Jonigan has joined us again. Mark, could you just say hello for just a minute so people can see? I'm going to come back to you in just a few minutes, but say hello.
Yeah, hello to everyone, and I apologize. I'm having bad internet problems in Dayton, Ohio.
Well, we're glad you're with us, and thank you. We'll be back to you in just a minute. At this point, I want to go to our next panelist, Lauren Davis, who's wearing two hats today. But Lauren, wearing your hat with Washington Recovery Alliance, what are some of the services, some of the valuable services that your RCO is providing in the community there?
That's a great question, William. We are actually simply an advocacy organization to fund RCOs that actually do direct services. So it's a huge array of things in the entire umbrella of recovery support services, but we have advocated strenuously for increased investments in recovery support services from block grant in our state to the point that we invest about a quarter of our SUD block grant now in Washington into recovery support services. And that's credit to both the Washington Recovery Alliance as an advocacy organization and to education of lawmakers about how important it is to not just fund one leg of a three-legged stool, the three legs really being kind of pre-treatment services or outreach and engagement to folks who aren't connected to services, and then of course treatment and then recovery support services. And when you start to unpack that for lawmakers, it's sort of this light bulb moment. People begin to understand, like my colleagues were saying, I mean, it would be, you're treating a chronic disease with an acute care model. It would be analogous to funding surgery and not funding physical therapy and then blaming the surgery for not working. And lawmakers begin to understand, and particularly lawmakers who might be concerned about fiscal implications, understand very quickly that the highest potential return on investment is actually keeping people who are already in early recovery in recovery is significantly more advantageous in terms of quality of life outcomes, but also cost savings than it is to go try to fish somebody out of a trap house, create a window of willingness, actually get them to treatment in that window of willingness, having them stay through treatment, only to drop them on their head again the day that they leave. So some of the things that we're doing, again, massive investments in recovery housing, investments in creating a sense of purpose, so education and employment pathways, investments in programs that promote social connectedness and intentional community, like recovery cafes, which were founded in Washington State, investment in technological recovery supports, some incredible smartphone-based apps out there actually that can really support long-term recovery, investments in recovery coaching and peer support, investments in transportation and childcare and legal support services for people in early recovery, and finally, significant investments in family support and education to really wrap around an individual who's going through the treatment and recovery process.
Thanks for that, Lauren. And I'm going to come back to you in a few minutes, but I want you to be wearing your other hat when we come back to you, because I'm going to ask you in a few minutes about what is the most effective advocacy that we can do with legislators. But just be thinking about that, and I'll come back to you in a few minutes. I want to go to Mark Jonigan now. Mark, thanks a lot for being here today. You're joining us from Dayton, Ohio, but of course, I know you from the Twin Cities Recovery Project in the Twin Cities. And we often talk about the fact that addiction doesn't discriminate, and neither should recovery. But too often we know that when it comes to recovery resources, there is discrimination. What is it, Mark, that the communities of color that you serve need most from the RCO that you are? Well, I guess I've lost him again. So I'm sorry about that. I had something up on the screen and I couldn't see that he had dropped. I'm going to come back to my colleague at Hazel and Betty Ford, Tori Utley. Tori, I was so intrigued when we were preparing for this event, and I learned that not only did you found an RCO, but you co-founded it with your father. How did that happen?
Yeah, so I think like many people that are involved in this movement, either you're a person in recovery or you love someone in recovery, and in that case, that's my father. And so my family had a pretty extensive journey walking through that with my father, and he found recovery, thankfully, and our family was transformed as a result. And now I have the opportunity to advocate alongside him and support people who are living in recovery. So when we had started working together on this chapter of reconciliation and hope that we'd experienced, we saw so many people that were trying to access support or trying to access treatment, but were unable to do so. So through involvement, through our family's involvement in our local recovery community, we started seeing these gaps. And, I think like many grassroots solutions start, we raised our hands and said, we've got to do something. So it started from a personal place of hope and recovery and moved into a commitment to helping others find that same hope.
Of course, you also are a colleague of ours at Hazel and Betty Ford, and you actually have a unique role in our training and the consultation and education division. You collaborate with a lot of RCOs around the country and treatment providers. Tell us what a recovery-oriented system of care is from your perspective.
Yeah, thanks, William. So recovery-oriented systems of care consider the person and the family at the center with their coordinated networks of resources. So what's so fascinating is that through our work at Hazel and Betty Ford, we see communities have different resources and different strengths and different DNA. And so a part of what's so intriguing about this conversation is that funding RCOs and funding communities really allows the community to direct solutions to what they know about their own community. And so that's a piece of how we get involved at the foundation as well. We leverage our long history of knowledge and resources and insight, but also partner with communities to help where we can. But what's so fascinating is we're constantly learning from communities in return, where unique innovations or solutions to problems are happening in these communities, and we're seeing this feedback loop as a result. So in our work, we have the ability not just to support the community, but to support key players in that recovery-oriented system of care, whether that's medical providers, legal professionals, behavioral health clinicians, as they're all doing their part to be contributors in this recovery-oriented system that's putting the person at the center.
Yeah. Thanks, Tori. I want to turn now to a national perspective with Greg Williams. Greg, has been around a long time. I think he really sort of launched the recovery advocacy movement beyond where it had been into the fourth dimension with the anonymous people. It's been quite a number of years now, but it still resonates with so many of us. And Greg, I know you produced a lot of other films and have some more in the works, but I want you to focus now on your groundbreaking report and study that you and your team at Third Horizons released earlier this year in 2021, especially the role that RCOs play, Greg, and how important federal funding is to these RCOs, no matter where they are in the country, no matter whether they're from blue states or red states. Greg?
Yeah, well, thank you, William, and it's this conversation is really exciting, and it was great to hear Congressman Phillips. And as a person in long-term recovery myself, I think the first thing that I need to say is Congressman Phillips and any other senator or congressperson doesn't get to vote for $350 million for recovery community support monies if we didn't have people in recovery in this administration who got this proposal into President Biden's budget. One very important individual who was in that film, but also has been a mentor of mine is Tom Coder, who's now serving as the Deputy Director of the Federal Substance Abuse Mental Health Services Administration. And so this proposal for fiscal year 2022 is a long time coming. People have advocated it forever, since I had learned about the recovery support movement. And I think what's really important here as we think about what Congressman Phillips said was, 70% of our funding for substance use disorder services comes from the public sector, which is very different than a lot of other healthcare issues, diabetes, heart disease, asthma. It's about inverse, where about 30% of that funding comes from the public sector and 70% comes from private insurance or from self-pay, that kind of thing. And so with our issue, it's the federal government becomes really important. In 1998, SAMHSA released the Recovery Community Supports Program, the first ever RCO program, really, spurned the creation of some of this in our modern context. And it was fascinating for me to learn a little bit about that history and how that kind of unfolded. And the federal government doesn't often get credit for innovation, but in this case, how you stitch together informal recovery activities that have happened in decades for years that created the formation of formalized treatment and everything else that we do in this country, right? How do you actually formalize that, stitch that together in a structured way that recovery community organizations that can partner with government, they can partner with other actors in the community, they can partner with the private sector, they can partner with clinical services and act as that bridge building, to sustain life in the community. And so in terms of the report and what we have been trying to help with is just help people have that voice at the federal level and try to provide some of that data. One challenge that we've had with this nascent, formalized of a recovery community is that we haven't had great data. And when the federal government gives out grants to all 50 states and territories with basically a blank check, I mean, there's some parameters around that check. But there's not a lot of requirements around uniform reporting. So each state and territory often will report their outcomes in very different ways when it relates to the federal block grant. And so as a result of that, we had to do some digging to try to pull out and tease out some actual data. The value of recovery housing, the value of community centers, the value of in Connecticut here where I live, our current administrator of the federal agency, the SAMHSA agency, who was our former commissioner, Dr. Delphin Rittman, became a large investor in peer coaches going into emergency departments to engage people to go to treatment. So just as Lauren talked about, that pre-engagement piece is also here. It's not just the post-treatment or those people who don't need treatment, but it's also that pre-engagement piece. We're starting to see that individuals in recovery who are trained and have some capabilities are some of the most effective people to encourage people to enroll in clinical services and or recovery support services. And so the report that we published helped educate lawmakers, both in the Senate and in the House, kind of about some of those shining examples of data around these different recovery supports. And it's really, I'll just end with saying it's really exciting. As Congressman Phillips said, you know, the proposal, not just, you know, when the president makes a proposal, often it gets to Congress and they say, well, thank you for your proposal. We're going to go do our own thing, because Congress has the power of the purse, as they say, and Congress gets to choose what they actually fund. And the president has, you know, some leverage power, but doesn't really get to choose. And in this case, you know, Congress listened to the president, and the proposal made it into the House bill that was voted off the floor back in July, and then just recently also made it into the Senate bill that was just released, the Senate Appropriations Bill that hasn't been negotiated, and it's not moving right now, but it's really exciting to see the language in both the House and the Senate bill. There's a little discrepancy around funding amounts, but by and large, it looks like $1 billion to $1.15 billion increase in the federal block grant, which will amount to hopefully we anticipate about $300 million for recovery support services in the FY 2022 budget. And just to put that in context with the last word is our current recovery community support program at the federal government, I think is a $12 million program or a $15 million program. So we're talking exponentially about the level of funding, and not every state is like Washington, where we're putting as much as they are of this in their kitty.
Big dollars at stake. And just a couple minutes, I want to come to Jeremiah to talk about the call to action. But I want to go back for just a few more minutes. Oh, and by the way, before I get on, in the chat is the Third Horizon Strategies report. I read the report and I learned a lot. And I've been around this field for 25 years, but I think the report is outstanding, not just in the depth and the breadth, Greg, of what you presented, but in the way you presented it, and the way I was able to read it and absorb immediately the importance of the information, what you had found. And so there's a link there in the chat. I would encourage everybody who has a passion for recovery community organizations to download that report. It's free, right, Greg? Free, and read it. It will help you in your advocacy, and it will help you in your efforts around recovery community organizations. Lauren Davis, I'm coming back to you out on the West Coast, because I want you, as I warned you, I want you to put on your hat as a legislator now, and I want you to tell us, most of the people who are registered here today are advocates down in the trenches. What works when we approach our legislators at the State House or in Congress, whether we do it by email, by letter, or by visit, even in these COVID times? What works from your perspective?
Yeah, great question. And just kind of expound on what I mentioned before, I think really helping educate lawmakers, even lawmakers who have significant personal experience with substance use disorder, which are actually many, they don't necessarily understand that there is more to the story than treatment, and helping paint that picture of really the three parts of the continuum of care: that outreach, pre-treatment services, treatment and recovery support services, and then explaining and unpacking what is recovery support services, what does that look like, and also helping them understand that of those kind of three legs of the stool, we actually only fund one leg, which is treatment. And the reason is you can bill insurance for it. And so we'll fund that over and over and over, but we will never fund the delta between the 90 some odd percentage of people with SUD who want care, the 11% who get care, and then on the back end, the recovery support services to help keep people in remission. So a couple points that I've made to my colleagues in the legislature that I think have really resonated in no particular order. One, you've heard today kind of this comparison to other chronic progressive relapsing diseases. Cancer comes to mind. So I have a number of friends who have had cancer, and they post, I just went for my 1-year checkup. My scans are good. I went for my 2-year checkup. And yet, when you think about substance use disorder, we send you to withdrawal management and then 28 days of intensive inpatient and then 8 weeks of intensive outpatient. And then we graduate you from a chronic disease. And it just, again, the light bulb sort of goes on with lawmakers when you compare it. With cancer, we would never allow, we would do checks, we would do scans, we would be making sure this disease stays in remission because it's fatal. And so is addiction. Another thing that has resonated is in Washington State, we have two types of death reviews. We do death reviews for suicide deaths, and we do death reviews for maternal mortality, women who die within 42 days of childbirth. And the reason we do those is because we want to unpack what went wrong medically and try to prevent future errors. But we don't do death reviews for overdoses. And the reason we don't is because there's no question as to what went wrong. We know exactly what went wrong. The one thing that almost all individuals have in common who die of an overdose or who are incarcerated because of addiction, or who are living in encampment because of their addiction, nearly all of them were at one point in recovery. Nearly all of them have had multiple encounters with our treatment system, and we failed them. We failed to harness that moment. We failed to bring down the moon for them, and we failed to keep them in recovery. And so, no, we don't do death reviews for overdoses because there's no mystery about what went wrong. We failed to fund recovery support services. So just really helping them understand that, and also understanding that your legislature is actually the one that controls block grant spending. When I got elected, one of our staffers pulled me aside and he said, you know, the healthcare authority, which is our single state agency, thinks it's their money, but it's not their money, it's your money. You control the block grant spending. And so you can just have incredible influence if you get even just one state senator, one state representative really excited about this and really energized. They can make a tremendous difference. It's not general fund state dollars, which are flexible and very contentious. This money has to be allocated to behavioral health. And so they're not inventing new money. The money is there. They're just redirecting the funds, and they can have incredible, unparalleled influence. So happy to talk more, but that's my 2 cents. Thank you.
Thank you. We're going to come back to you in a little bit. We've got about 25 minutes or so. We've got a lot of ground to cover. We also want to remember that Jeremiah is going to give us the call to action. But I want to come back to Wendy Jones, the Executive Director of Minnesota Recovery Connection, and then I'm going to come to you, Tori, after that. But Wendy, how do you measure, as an RCO, how do you measure the impact of the dollars you spend on the lives that you serve?
Yeah, thanks for that question. How do I measure it in terms of actual data outcomes? Is that what you're asking, William? Or
well, that'd be part of it for sure.
Yeah.
Absolutely.
Sure. So, I mean, it's a huge range of measurement. On one hand, the dollars that are invested into our organization, we're accountable to measure those and report back to all of our funders, no matter whom they are. And that's one of the key elements of being a nonprofit, is that accountability in that. So we measure it in terms of how many people that we have been able to connect with who otherwise may not have had any support in their recovery. We measure it in terms of how many of those people come back for continued support. So we look at the length that someone stays with us. We measure it in people who come back to volunteer with us, because giving back is a key part of sustaining one's recovery. We look at something called recovery capital. So those investments in my ability to sustain my own recovery. So that could be, do I feel like I'm stronger financially, socially, with my relationships, my physical health, in my job life? And so these are all the touch points that, as we work with individuals, that we're using to measure the long-term impact of our support services. We look at people who maybe got into treatment and hadn't contemplated that before or been able to do that. Sometimes we physically drive people to a provider because that was a barrier for them. We also look at the number of people who we can touch through advocacy, who we can have that little light bulb go off, and just thinking about the words that we use and how that changes the landscape of recovery, to talk about a person first in recovery and not use stigmatizing language like an addict or someone who's clean, because the opposite of clean is dirty. I may have been in active addiction, but I was never dirty, So I could go on, but there's a lot of touch points that we use, ranging from numbers that we've served to that long time progress, and our ability to grow our programs to meet individual needs more specifically. From those who've experienced incarceration, we have a whole program that specifically serves that life experience, to people who've experienced housing insecurity. We have a whole program designed to provide peer support through that. And I'll go on and on.
Yeah, well, thank you for that. That's because I think it's important that if we're going to ask for more dollars and get those dollars, we need to make sure that we demonstrate the value of the dollars that we get and how we spend them to support individuals in recovery and communities. So thank you for articulating that. Tori Utley, the co-founder of Doc's Recovery House. What would you do, Tori? What would be the one or two or the three areas of your recovery community organization that you would be able to amp up with additional dollars?
Yeah, that's a great question and very timely. So actually this last week, we were finally able to open a women's house after 2 years of aggressive fundraising. And, you know, the challenge is capacity building, it's staffing, it's having, you know, the need is there and the need is great. But, you know, unfortunately, because we've been an underfunded service, there's a limit on how quickly you can grow, on how many people you can serve. So I think, you know, what we would be able to do, I'm speaking from Doc's Recovery House perspective, but I think across the board is put that creativity and that passion to even greater work. You know, you have to unfortunately look at, you know, where you're going to do your best work with the limited resources you have at the time. You know, for us, that was starting with one house to do pre-treatment housing and post-treatment housing. And, you know, then our energy has been into not only sustaining the work that we started, but looking at how do you grow to actually be meeting the need. So that's a piece of this federal investment that's so important, is you have in the grassroots RCO community so many innovations, like I spoke to in my last answer. You know, you have innovations all across the country, but what does it look like when that grant runs out? What does long-term sustainability look like? Because, you know, perhaps even worse than not having the service is implementing the service for a temporary period of time and then that service going away. So that's, you know, long-term capacity building and sustainability, so that the foundation on which we all operate could be secure and could commit to people that this solution, this service will be around for years to come, whether you need it once, a family member needs it, or you happen to need this support again down the road.
Yeah, thanks, Tori. And just, I'm going to give Greg Williams a heads up in just a few minutes. I'm going to come back to you, Greg. I've got a question or two for you, but I want to see if we can bring Mark Jonigan back into, if not the picture, at least back into the debate, because it looks like, Mark, you're on without video. Can you hear me, Mark? Well, there's always something, but here we are. Progress, not perfection. We got to always remember that, right? So, Greg, I'm going to come back to you, and then I'm going to go to Jeremiah on our call to action, because I think that's very important. Greg, you've been around this field a long time for a young guy. You have almost single-handedly driven our advocacy efforts over the past decade or so. When did the Anonymous people come out? What year was that?
2013.
So it's been 8 years, and I just wonder, Greg, from your perspective, how good have we gotten as recovery advocates in standing up and speaking out for what we need and what we and our clients and our fellow travelers deserve? Have we come a long way or not?
I feel like you should be answering this question, William. You know, it was a pinch me moment when I got to sit down with you and learn about, you know, your journey in the late 90s and in the 2000s and walking the halls of Congress and fighting for, you know, parity when there wasn't a bunch of bipartisan congressional leaders talking about addiction. And so, you know, I get asked this question quite a bit now in terms of, like, you know, how are we doing? And, you know, it's breathtaking that there's a presidential proposal with bicameral support for $350 million, you know, into recovery, $1 billion more in the block grant, a $2 billion, opioid program that might go to 2.5 billion, 15 billion to 20 billion just in the last, 5 years of federal appropriations around these issues. There was not even a fight when the ACA passed that substance use disorder was part of an essential health benefit, because the fight had been won on parity a couple years before that. Prevention funding continues to increase, and one thing we should all watch as recovery advocates when we get this set aside. Prevention, they've had this set aside for more than 2 decades now, and it's been there every year, and it's been appropriated every year, and it's not enough, but it's certainly really important. And I think all of that in context is really breathtaking to see how much political leaders have come onto this issue. The sad truth, though, if I'm really honest, is it's probably not because we've gotten really skilled and robust with our advocacy efforts. It's sadly the poison drug supply forced them to the issue in a way that this country had never seen before. We've seen pandemic proportions of drug overdose deaths, and it's not necessarily because substance use disorder rates are going up. Quite frankly, the death rate and the mortality rates that we're seeing is really sadly because of a poison. At first it was the prescription opioids, but now, for the last 7 to 10 years, it's been a poison drug supply that we've had, and it's just creating mortality at really epidemic proportions. And so, if I'm really honest, we have a lot more to do from an advocacy standpoint, and we have this moment that we still can capture. But we do have the ear of people listening when we show up. And just as Lauren said, it takes one senator, it takes one, congressperson to make this their issue. When you championed parity, you had Kennedy and Ramstead, and then you kind of, arm wrestled the Senate to the table. But that's all. That's, in effect, then everybody voted for it. But that's what it took. It takes leadership, at different levels, and Tom Correa gets $350 million in the FY 2022 budget. That's what it takes somebody to make this their issue and champion it. And so we need to do better. The coolest part that I just got an email this weekend, somebody in Illinois is running who's in recovery. Marty Walsh is the Secretary of Labor as a person in recovery. We've got, elected representative on this Zoom here who's leading, the state of Washington's response. That's where I'm really excited about the next wave of the advocacy, where people are like, I was at a film screening 3 nights ago, and a woman said, well, I'm going to run because my congressman's retiring, and I don't like what's happening, And so I think the willingness of the recovery community to stand up and take that next step, even not saying it's above or different, but those that are interested, willing to serve at the legislative level, that feels like the next frontier for our advocacy movement, is electing people with lived experience or allies who are going to run on this issue, get elected on this issue, and then go do the right work that needs to be done on a leadership level once they're elected.
Great. Thanks very much for your perspective there. I know you're a lot younger than I am, but you've got a very rich experience, and you are in the vanguard of the next generation. So to you and all of our panelists here today, it's up to you, because some of us are getting old and been around a long time. But it's heartening for me, candidly, to be able to see so many great advocates, whether it's Lauren in Washington State or Wendy close to home, Tori and Mark and you leading that fight, and my colleague Jeremiah Gardner, who is really part of that vanguard at Hazel and Betty Ford, and who really pushing the envelope to raise advocacy to the level of effectiveness. And so with that, Jeremiah, I'm going to ask you to appear on camera. There you are. We've got about 10 minutes left, and we want to make sure we end on time. But Jeremiah, the floor is yours now in terms of how we go about raising this issue, not just with us here on this town hall, but with our legislators from the red and the blue states across the country. JJ?
Well, thank you, William, and thank you to all the panelists and to Congressman Phillips and Representative Davis and everybody who's tuning in on behalf of Hazelton, Betty Ford, and Minnesota Recovery Connection. We really appreciate it. Really fascinating perspective there from you, Greg, at the end. We need to continue that conversation and start by today with some more skillful advocacy, and that starts with our call to action. And I'm going to paste once again in our chat here a digital call to action, and that's what I'm asking people. Contact your members of Congress and urge them to support the president's proposed increase in block grant funding and the 10% recovery set aside, and ask others to do the same. So advocate directly to your members of Congress, ask others to do the same. It's really easy. That link, if you click on it, it's just a click or two, and no matter where you live, you can send a message to your own members urging them to support it. A lot of the groundwork has been laid, as you heard earlier, with proposals in the House and the Senate. So this is where it gets down to the nitty gritty. So copy that link, share it, click into it yourself to advocate to your own senators and House member if you haven't already. We'll also send a recording of today's webcast to share with your own individual networks. We've got a late breaking message here. Representative Phillips is planning to join in a moment live. That's fantastic to hear, William. I'll turn it back over to you in just a second. I'll just finally say this is a historic opportunity for our advocacy, as Greg laid out, to make a difference for recovery communities across the country. So I appreciate everybody being here. And William, it's back to you.
Well, it's back to me, and I don't have any more jokes, but I want to make sure that we, because I thought we were going to be wrapping it up. I'm very excited to see that Congressman Phillips is going to try to join us. I don't see him yet, so Budge, when and if he shows up, let me know. But in the meantime, let's have a little bit more of a conversation with our panelists. I may need to cut you off, so please don't take it personally. I'll apologize to you later professionally. Wendy, what kind of advocacy are you all doing at Recovery Community, at Minnesota Recovery Connection?
Yeah, thanks, William. And there's a question in the Q&A that's been lingering that I said I would answer live. So I think I'll just do that real quick, if that's okay with you too.
Yeah, go for it.
And it leads into advocacy. The question was about recovery community organizations being nonprofits, required to be nonprofits, and why should we be excluding any advocates in this fight? Focus on practices, policy, performance, outcomes versus tax designation. And I just want to say that we need all the advocates, and so for-profits and non-for-profits. So there is not a designation that if you're an RCO, you advocate and others can't. And I would say it's not about the tax designation so much as it is about the fact that as a nonprofit, recovery community organizations really fill a gap. Nonprofits exist because there's either a market failure that no one could possibly, the market could not sustain the cost of the services that we provide. And the government, the services that we provide are too local, too personalized for the government to be able to do that. And so that's where we fit in as a nonprofit. We fill those gaps. And as a nonprofit, none of what we do materially benefits the board of directors or the quote unquote owners of the nonprofit. And that's critical because what we provide is free, that there are no barriers to accessing our recovery supports. And we couldn't do that if we weren't a nonprofit. So just wanted to make that statement, but also say, please advocate as a for-profit or a nonprofit. And that's one of the things that we're trying to do, is to engage a cross-sector of organizations in this conversation. And we were so thrilled that March, our organization in Minnesota that really supports primarily treatment providers on a legislative level, partnered with us to get legislation passed in Minnesota to support recovery community organizations. And I think that was a huge step forward to have us working together holistically to address the issue of substance use disorder and realizing that recovery is not taking away from treatment, that we're working together and enhancing and improving the outcomes for individuals. So that's one example of the things that we have been doing to advocate.
Thank you. Oh, there he is. But I'm going to just hold on now. Okay, Congressman Phillips, can you hear and see me?
I can. Hey, everybody. I'm so sorry.
No. This is perfect timing because we had you on video, which meant you got the first word, and now we're near the end, which means you're going to get the last word. And there's nothing better. So I want to thank you on behalf of all of us who are joining today for your efforts, not just on the legislation we're talking about, but for your efforts to be here today, because I know you're very, very busy. We'd love to give you the floor, but I'm going to give you the floor by asking you, what do you need from us to help advance this legislation to support recovery community organizations?
Well, you all know the old adage, the squeaky wheels get the grease. So we got to keep squeaking. And I think it's working, and your advocacy, your passion, and your thoughtful dispositions go a long ways, and it's working. And I'm fingers crossed that, I'm wearing the same outfit as you saw in that video because I had to film that this morning. So it's not that I wear the same outfit every day, but I'm optimistic. I think we're going to get these bills done with a lot of new support forthcoming. I referenced that in my earlier remarks, and I just want to thank all of you. It's been a long time coming, a lot of blood, sweat, and tears. But it's paying off, and may it be a beginning. Without your advocacy and personal investments in this, it wouldn't happen at all. So I never want to make a promise because they're so easily broken in Washington, but I think we're going to see some good things in the days ahead. And I just want to extend my heartfelt gratitude to all of you to keep the faith, keep in touch, and keep persevering because we're going to get this done.
Well, let me ask you quickly before we go, you've been in Congress for a while now, when did you see the shift, and when did this issue become a issue on both sides of the aisle, in red states and in blue states? What was it that made it everybody's issue?
Well, there's no such thing as an overnight sensation. We feel that way sometimes after hundreds, thousands, sometimes millions of people have been trying to advocate for issues for many, many years. There are certain members of Congress who I believe have done yeoman's work. David Trone is a member of Congress who joined with me in 2018, has made addiction legislation, recovery legislation, a hallmark of his career. Of course, I referenced Abigail Spanberger earlier today. The good news is that Democrats and Republicans, those with intention, have come to realize that these are issues that everybody faces, every family, not Democratic or Republican families, but throughout the entire country. And I think shining some light on the truth, which so many have hid for so long in so many cases, has been liberating and I think unifying. And I give credit to a lot of members of Congress, but without advocacy from all of you, it wouldn't make a bit of difference at all. And that's why I'm so grateful to all of you. But that's why.
Jeremiah Gardner, do you have a question for the congressman before we close out here?
No, I just want to say thanks on behalf of Hazel and Betty Ford once again that you for making double the effort today to be with us, and to all of our panelists as well.
Well, thank you. Usually the third time is the charm. So if you want to call me later today, I think that's when I'll really nail it.
Well, no, you've nailed it. And we really appreciate, not only are you a great representative of the 3rd District in Minnesota, but you are representing this issue with constituents all across the country, Congressman Phillips. So thank you so much for your passion, your commitment, your political expertise, and for your willingness to be here with us today. Thank you, Congressman Dean Phillips. Thank you.
Thank you, everybody. Godspeed, and keep the faith. We're going to get it done.
Keep the faith. And for the rest of us, we will keep the faith. Each of us is going to wrap it up now and go back to our respective RCOs, our respective communities, our respective members of Congress, our respective state legislators. I want to thank our panelists today for giving us the energy and the expertise to go back to those places where we do our work and to make a difference by standing up and speaking out, not just on the fact that treatment works, but that recovery is possible. And that when people like me and so many of us recover, we benefit not only ourselves, not only our families, but we benefit our communities. So on behalf of all my colleagues at Hazel and Betty Ford, and on behalf of our remarkable panelists today, thank you for joining us for this town hall meeting. Please take action, and you can follow up with Jeremiah directly if you have any follow-up questions. But for this time, it's time to sign off, and thank you all for being with us today.